Well, reopenings are happening across the country as the public and businesses work to recover from the pandemic. UAB Dr. Craig Hoseley joins us tonight to talk about medical changes needed post-COVID-19. Good evening, and thanks so much for joining us tonight.
Thank you.
Well, when it comes to the fight against COVID-19, what areas of general medicine practices and treatment, in your opinion, need improvement?
I think the epidemic in Alabama has really demonstrated just the impact of chronic illness in Alabama. So we know that individuals with chronic illness, comorbid illnesses like cardiovascular disease, hypertension, diabetes, obesity are impacted more by the virus. And as Alabama ranks near last in those vital health statistics, it's been pretty obvious that that's the group that's impacted.
Are there any specific techniques or technology that you and other healthcare workers have and officials have discovered that can maybe fill some gaps in healthcare coverage and treatment?
Yeah, the advent of telehealth, we were using it previously on a small level at UAB and in other health centers around the state. But it's really expanded greatly in this pandemic, and I believe it's here to stay. I think that one of the ways that we can impact medically underserved areas in the state, rural areas, is going to be through telehealth. So in some ways, it's been a good advantage for us to have a headway with telehealth.
Talking about those underserved communities, in addition to that telehealth, what steps do you think that healthcare systems need to make to maybe provide consistent healthcare to those communities?
Well, I think, on a lot of levels, for Alabama in particular, expanding broadband access, internet access into areas that currently don't have it will help, particularly as we think about telehealth. Some of our medically underserved areas also don't have hospitals. I think we need to look at the medical infrastructure in those areas, or how we can connect to larger medical centers around the state and get clinicians in that area. In the medical schools, we need to develop pipelines for rural medicine and expand into primary care across the state. It's significantly needed.
And will the healthcare industry be more prepared for, let's say, the next health emergency after going through this crisis? And if so, in what way? Because we know that PPE has been a big problem, or it was at least in the beginning of this pandemic.
Oh, absolutely. I think that we're going to learn a great deal from this, and we need to leverage this opportunity to prepare for the next time. Hopefully, it'll be a long time away, but you can just see in our ability to kind of ramp up vaccine manufacturing and accelerating the effectiveness studies with vaccines, and there's several in the pipeline that look promising, is really impressive. And many of us didn't predict that we could move this quickly. So our capacity to develop new treatment modalities and new vaccines, I think we've, are identifying a mechanism to move very efficiently, much more efficiently than we did before. And in terms of PPE, I think, this pandemic has proven to us that we need to have a national stockpile, and we do need to prepare for that moving forward. So I do think we'll be much prepared from a testing standpoint, from a protection standpoint with PPE, and also with therapeutics.
All right, Dr. Craig Hoseley, thanks so much for your time tonight.
Thank you.